word osteoporosis comes from the combination of two Greek roots, osteo meaning bone, and poros meaning porous or fragile. These two roots succinctly describe the disease. Osteoporosis is a systemic skeletal disease characterized by low bone mass and deterioration of bone tissue. Its effect, as its name suggests, is the weakening of bone tissue in the body. There are no direct symptoms of osteoporosis. However, it does result in increased risk of bone fractures that would not occur otherwise. These fractures are known as fragility fractures. They typically occur in the vertebral column, rib, hip, and wrist. The underlying mechanism behind osteoporosis is an imbalance between bone resorption and bone formation, or ossification. To understand how this imbalance causes the disease, let's look at what normal bone metabolism looks like. There are two unique cells that facilitate this process: an osteoclasts, which break down old bone, and osteoblasts, which build new bone. Osteoclasts participate in bone resorption, the process in which the osteoclasts break down old bone and transfer its minerals into the bloodstream. Ossification is new bone formation, or the process in which osteoblasts regenerate bone using minerals and nutrients from the bloodstream. Ossification and bone resorption are the two phases of bone remodeling. When these phases are thrown out of balance, osteoporosis can occur. But how would this imbalance occur? What regulates bone remodeling? Well, the answer is actually relatively complex, as regulation involves several endocrine glands and multiple hormones interacting simultaneously in the form of a negative feedback loop. The thyroid and parathyroid glands form a negative feedback loop that maintains the calcium level in the blood at a homeostatic range. Because the majority of the calcium in the body is stored in the bones, the thyroid and the parathyroid glands need to be able to influence bone remodeling so that they can maintain the proper calcium level in the blood. When calcium levels are too low, the parathyroid gland releases the hormone PTH, which stimulates osteoclasts, increasing bone resorption. When calcium levels in the blood are too high, the thyroid gland secretes calcitonin, which inhibits osteoclasts, allowing osteoblasts to rebuild bone with the excess nutrients in the bloodstream. Estrogen is the sex hormone, formed in the testes in males, and in the ovaries in females, and in the adrenal glands and in the liver in both of them. Estrogen is another hormone that affects bone metabolism. Estrogen inhibits osteoclastic resorption and targets osteoclasts by signaling for them to undergo apoptosis, or programmed cell death, thereby slowing bone loss. In healthy human beings, bone resorption and bone formation are in equilibrium. The amount of bone destroyed is equal to the amount regenerated, so bone density stays the same. Increases in bone resorption or decreases in ossification can cause overall bone density to decrease. These factors are affected by the calcium feedback loop. However, when this delicate equilibrium is disrupted, osteoporosis can occur. If calcium levels are too low, the parathyroid gland will secrete PTH, which will stimulate osteoclastic bone resorption. This will break down the bone to release the calcium stored within it. But if there is a chronic deficiency, the bone will never be regenerated, leading to decreased density and ultimately osteoporosis. Postmenopausal osteoporosis is another instance of when the balance of the hormones is disrupted. After menopause, many women experience a decrease in estrogen. Less estrogen leads to uninhibited osteoclastic resorption, which decreases bone density. People of European or Asian ancestry are especially susceptible to osteoporosis. Age is another main factor. Older people are much more likely to exhibit signs of osteoporosis, especially postmenopausal women. More than 30 genes are associated with the development of osteoporosis. It is highly inheritable as a result. Bisphosphonates inhibit bone resorption and encourage osteoclasts to undergo apoptosis, or cell death, thereby slowing bone loss. It causes effects similar to those of estrogen. Bisphosphonates are the most common and effective means of treating osteoporosis, and they are generally prescribed by doctors. Hormone replacement therapy replaces the estrogen lost during menopause, restoring the homeostatic interaction between calcium level and bone metabolism. It's recommended only for women who are having other menopause-related symptoms. The French pathologist Jean Lebenstein is recognized for selecting the term osteoporosis and discovering its pathological appearance. The American endocrinologist Fuller Albright discovered the link between osteoporosis and menopause.